The birth of a child is one of the greatest miracles in the world. And every woman deserves to have access to the finest care available to ensure a safe, healthy and joyful childbirth. But for thousands of women from poor and marginalized communities in rural India who receive no prenatal care and deliver in unsafe conditions without a skilled health worker, the journey to motherhood is often a matter of life and death. As a part of the Millennium Development Goals, Oxfam India initiated a project under the Global Poverty Action Fund with support from Department for International Development to improve the status of maternal health in 6 states of India. Aimed at strengthening community capacity to demand access and monitor public health services, at the same time engaging with the health system at multiple levels to address the long-standing gaps. In the tribal-dominated Kandhamal district of Odisha, where poverty is stark and resources are hard to come by, addressing maternal health is a key challenge. But the villagers here seem to understand its importance and have come up with innovative solutions to improve the situation as a result of Oxfam India's intervention to improve maternal health in Odisha. They are creating a village health atlas based on different social parameters to identify the number of pregnant women in their village and the status of availability of health services. Making the village health atlas has enabled the community members, particularly women, to participate in the health planning process. It has increased their awareness and brought in a perceptible change in attitude regarding accessing health services for the very first time. Martha Diggal, the Asha who has been steering the process, says that the situation in the village was entirely different few years back.
आम गाँव रे किछि स्वास्थ्यर सुविधा जोड़ा कि मेडिसिन उपरे बा जे कोनसी जने गर्भवती माँ रो जत्न उपरे कि प्रसूति माँ रो तार शिशुर जत्न उपरे आमे किछि भी जान नथिलु ता बादे बहुत असुविधा होतला जोड़ा कि घरे डेलीवरी होउथिले घर भी डेलीवरी हे कि केते को पूरा लोबात छुआ जाको जन्म होउथिले मरी भी जाउथिले आ जन जन डेलीवरी न होई कि जन्म करि न पारि कि मध्य माँ माने भी मरुथिले.
Poverty, illiteracy, superstition and limited access to health services had contributed to several maternal deaths in the region.
In Odisha, we wanted to focus it in tribal districts, and that is, one is Sundargarh, second one was in Kandhamal. And 70 villages in these 2 districts were covered under the project. If you look at tribal, in the tribal districts, the health infrastructure wise, though there are PHCs, there are health centers, but you don't find proper equipments there, proper manpower. Enough manpower is not there.
Keeping new mothers and their babies alive is important for everyone in the community, not just women. Therefore, any initiative to improve maternal health has to ensure the active involvement of the community. Through meetings and trainings, Oxfam India began to enhance the capacity of community, local institutions like Gaon Kalyan Samiti, Anganwadi workers and Ashas, as they are responsible for rolling out government schemes.
So in last 3 years, we have raised awareness around maternal health and what needs to be done to ensure proper maternal health in all these project communities. apart from that, we have also worked with various institutions that is existing in the community. Those are Gaon Kalyan Samitis, we have Anganwadi Kendra, we have village food and food security committees, and where we have also built their capacity to understand what is needed, how they need to behave when it comes to maternal health, and how they can actually mobilize and access more benefits from different government programs.
Today, the communities are actively involved in the monitoring of government schemes and facilities to ensure their proper functioning and see to it that the benefits reach the people. Improved awareness and dialogue on maternal health in the villages has in turn led to more and more women accessing the services of Anganwadis and public health centers for regular checkups and immunizations. Issues like family planning, sterilization, birth spacing, and use of contraception are discussed in GKS meetings. Thanks to the efforts of dedicated Ashas like Martha, the villages are seeing more than 90% institutional deliveries.
ମୁଁ ଯେତେବେଳେ ଗାଁକୁ ଯାଉଛି ଭିଜିଟ୍ କରିବାକୁ ଯେତେବେଳେ ଯାଉଛି କେତେକ ମାଆମାନଙ୍କ ପାଖକୁ ମୁଁ ପହଞ୍ଚିକି ସେମାନଙ୍କୁ ବୁଝାଉଛି ସ୍ୱାସ୍ଥ୍ୟ ବିଷୟରେ ଯେକୌଣସି ବିଷୟରେ ମେଡ଼ିସିନ ଉପରେ ଯେକୌଣସି ତାଙ୍କର କ'ଣ ସମସ୍ୟା ଦେଖିକି ମୁଁ ସେ ଅନୁସାରେ ସେମାନଙ୍କୁ ବୁଝାଉଛି। ବର୍ତ୍ତମାନ ତ ପ୍ରାୟ ବହୁତ ପରିବର୍ତ୍ତନ ହେଲାଣି ଆଉ ଯେଉଁଟାକି ମୋର ଏବେ 2 ବର୍ଷ ପୁରା ଗୋଟିଏ ବି ହୋମ୍ ଡେଲିଭରି ହେଇନି, ସବୁ ମେଡ଼ିକାଲ ଡେଲିଭରି ହେଇଛି ବା ଗୋଟିଏ ବି ଶିଶୁ ମୃତ୍ୟୁର ହେଇନି କି ଲୋ ବାତ ଛୁଆ ମଧ୍ୟ ଜନ୍ମ ହୋଇନାହାନ୍ତି।
Oxfam India and CYST work towards improving the health and nutrition of adolescent girls. The girls were initially formed into groups called Kishori Kalyan Samitis and educated on the risks of early marriage and pregnancy, and were taught simple ways to maintain health and hygiene.
This Kishori Kalyan Samiti that was promoted in the villages played a very crucial role in generating awareness through different activities. They went to all the households in the villages, they spoke to the families, they tried to generate awareness saying that early marriage is actually going to impact one woman in rest of her life.
These efforts have proved to be hugely successful at the ground level. When the marriage of 17-year-old Sujata Behera was fixed by her parents, she took a bold decision to prevent it with the support of girls from KKS. The teenager was firm. She said she would marry only after she turned 18 and finished school, thus setting an example for the other girls in her village.
बो कहले बो मु बाहाबिनी कहली तो बो कहले कहीं बाहाबू ना कहले मुझे कहली कि ना कम बयस बाहा जदि हम तो केते गुड़ी समस्या रही कम बयस जब बाहा तो मोर निजर क्षति हम से तेणु मुझे बाहाबी ना बोली कहली तो बो मत मैंने गाली कले तू आग हाँ कलु पुणी पर मना करूँ बाहाबिनी बोली तो एबे आमे ताकू हाँ कहचु तो से माने मते कौन कौन कहबे बोली कहले जे मु कहली तमे जदि ताकू डाकबो तमे मना करबो से मानबे ना जदि बोले जदि तांकर छाने अछि बोले से क्याड बाहा करंतु जदि क्याड प्रस्ताव पकेबे तो पकांतु किंतु मु बाहाबिनी बोली कहली।
Initiatives such as this have given the power to hundreds of girls to say no to child marriage and save themselves from a lifetime of bad health and the misery of unfulfilled dreams.
मु कम बयस रे बाहा करैबी नै मो झियो को बोली अब मु माँ को कहली मु मो गोड़ रे छिड़ा हेबा को चाहे मु +2 +3 पाठ सरिया जाए पाठ पढ़िबा को चाहे तो कहि के माँ को कहली माँ 10th रे एडमिशन कर देले आउ थरे।
Through Oxfam India's intervention, the progress in improving maternal health parameters at the grassroots has been steady. Today, people realize the importance of marrying at the right age proper birth spacing, and availing the ante and postnatal care services made available by the government. Today, people realize the importance of marrying at the right age, proper birth spacing, and availing the ante and postnatal care services made available by the government.